Welcome once again to my channel. My name is Dr. Deku. In today's video, I'm going to tell you about ways or things to do in order to live long after you have been diagnosed of any chronic illness at all. I've encountered quite a number of patients who were diagnosed of chronic diseases, and it didn't take so long for them to pass away. And I'm sure that there are certain things that they probably did not know, or certain things that they didn't do, and that was what accounted for their early death. The fact that you have been diagnosed of a particular chronic illness doesn't mean an end has come to your life. It doesn't mean that your life has been shattered. It doesn't mean that your life has come to an end such that you can do nothing at all in life again. I think that is the perception a lot of people have, and so after they are diagnosed of chronic illnesses, they go home depressed, and out of the frustration and so much thinking, they end up dying. I do not want that to be your case, or I do not want that to be of any of your friend or relatives' case. That is why I'm coming all the way to make this video, to enlighten you on certain things to do in order to prolong your life even after you've been diagnosed of any chronic illness at all. So the first thing you have to do after being diagnosed of a chronic illness is to come to the stage of acceptance. You know, if you do not accept your condition, there is no way you are set to do anything to improve it or to better it or to even treat or manage it. So the first thing you have to do is to accept. If you are told you have hypertension, if you are told you have diabetes, if you are told you have sickle cell disease, any chronic illness at all, you have to come to the stage where you accept that this is the situation. It is after you've accepted the situation that you can try to do something about it. But if you remain in a stage of denial, then you may not even realize the need to do anything about the particular situation. So the first thing you have to do is to come to accept the situation, that this is the situation at hand now. Then you go to think of what can be done to improve it. So first, accept. The second thing you have to do is to become a student of your illness. If a doctor tells you you have hypertension, diabetes, or whatever chronic illness at all, HIV, asthma, cancer, whatever, you have to come to a point in life that you become a student of that particular illness. What do I mean by that? What I mean by that is you will try to read about your illness. You try to ask your doctor questions to get to a point of understanding of that particular disease condition. Because if you get to understand that disease condition, it will help you to know what to do and what not to do, what to eat and what not to eat. It will help you understand the condition itself and how to better manage or treat it. So you have to get to that point where you become a student of whatsoever illness that you have been diagnosed with. The third one is that you have to take your medications as prescribed by the doctor. You know, a lot of people come to the hospital, they are told of their condition, they go home and they get so much depressed, they do not take their medication, and they come to the hospital with complications of the illness. You have to understand that if you do not take your medication, you are not doing yourself any good. If you do not take your medications as prescribed by the doctor, some people take it, but they don't take it as they have to take it. They take it today and then they wait another week before they take it. That's not a right way. You have to follow your doctor's instruction. Take the medications as it is prescribed if you want to do yourself good. The next one you have to do is that you have to attend reviews and checkups on time. Some people are there, if you ask them to come for a review on a particular date, they do not. They tend to decide when to show up to the doctor's office, when to come, to see the doctor. You have to understand that doctors are there to help you, and so you have to do things that makes it easy for the doctor to help you. If you try to prove stubborn, then you are not helping the doctor in any way. We all know that being diagnosed of any chronic illness is not a good news, and we are not praying for that to happen. But then if it happens, then the best thing we can do is to make sure we school ourselves, accept the condition, and then make sure we take our medications on time and get to visit the hospital as and when we have to. So basically, these are the few things I want to share with you. There are a lot more. You can also share your thoughts on it in the comment section. Take care and have a beautiful day. I'll see you again in the next video. Bye-bye.